Hey, everybody. Today we're getting together with Andy Baker, CEO and founder of Rise Health Group, who is one of our strategic partners in our alignment to work with solutions nationwide and trying to bring in and match solutions for organizations, specifically with Rise in the healthcare space. And, I want to talk today with Andy and learn about Rise Health Group and then talk about our partnership and how we do things and how we are applicable to healthcare organizations all over the place and some of the big wins that we've been celebrating here. So today, Andy, thank you for joining us. And we're gonna just do an overview of what we do together. So tell me about you, tell me about Rise, and let's just talk a little bit and let our audience know what we do.
Yeah, sounds good. Thanks for having me. About me, gosh, there's never a lot to talk about, I guess. I chase around two kids when I'm not working and putting together, events for Rise and, a few other entrepreneurial ventures that I pursue. But really, at the end of the day, I enjoy connecting people. And I've said it for years, if I can figure out somehow how I can make a living off connecting people, then that's, what I want to do. And at Rise, really, our vision statement is pretty simple. We believe that better healthcare depends on better relationships. And that just means that if we can get better, more authentic, real conversations going face to face, person to person, then we really do believe that, the rising tide lifts all ships, which is where the name comes from. And we can make a difference just by making those connections. We don't want to be in the forefront, but we want to help support folks in sitting in that CIO or IT director role, and being able to connect with each other and say, hey, what are you doing at your hospital that I need to know about? Or here's the struggle I'm having. What have you done about it? And be able to have those real conversations. And we host retreats. That's one of our marquee events, is a leadership retreat. And we take registration information, we survey the CIOs that are registering for that event, and we ask them, what is it you're working on? What do you need help with? What are your successes? What are your things that you're looking out for? And we're able to pair people up and get those conversations going and have structured roundtables around events that are important to that group of people. So it really enhances the time spent together, makes it more valuable for everybody. And that's our goal, is to continue to grow and make the value more and more. But one of my favorite stories, I have to say, came from our very first event, which was we had two IT leaders talking to each other, one from New York, one from Texas, talking about installing a particular technology.
That's
And
right.
one was
Yes.
struggling with it. And the other one, this is just at a cocktail event after our conversations and after our roundtables. And, the one from New York says, we had the same problem. Tell you what, let's get our people talking to each other and see if we can't help you out and get you some of the resources that we ended up having to use. And I followed up, and, it wasn't more than a month later that everything was taken care of, done and installed and up and running. And so those are the kind of conversations that we really exist for.
Absolutely. And Rise is applicable to any healthcare organization. And bringing in that level of expertise from that organization focused on the CIO, CTO, chief data officer, really as anything in the tech space. I mean, it's able to bring that in, and that's extremely valuable because you are connecting them. You have a community, a private community that those CIOs, CTOs, and whomever live, and they can learn and amongst themselves and educate and not have to be worried about any kind of external influences other than
Right.
the education process, which is content that we provide to you for them, or you actually even I know that you interview a lot of them to get their take on things that they're doing in their organizations and their big wins and their celebrations for the solutions that they're doing. So your community is big. Tell me just a few minutes about your community.
Yeah, the retreats, it's really kind of forming your own board, right? Your own board of peers that you can work with each other on. And to your point, CNIOs, CMIOs, CIOs, CTOs, you name it. And if you can have your own group of people that you can treat as your board, and you can send a message to them and say, hey, I'm working through this. What are you guys experiencing? And that's separated from your organization because you have a group of people that are really working together and wanting to improve each other and each other's systems. That's the way that we see the world, right? And so one of the ways that we've done that is we have an app that uh, our community members can use. It's exclusive to the hospital executives. They can log in, check that out, have those conversations, share that information. And we share information as well. Like you said, those interviews. We've had webinars, most recently on AI.
Yep.
And so those are the ways that we really bring that community together and support them. And that really it all starts with conversation. And so as I'm talking to folks and hearing from them and learning what they're going through, we try to put together the content and try to make the connections that are relevant and can really help take them hopefully to the next level or alleviate some pain points.
Absolutely. And so let's kind of dive in and talk too about how we make these connections with the suppliers and, educate them, I guess, basically. And I guess that would kind of shift to my side of the story of what we do. And so, just to kind of give you an insight, Rise brings in all of the different providers, which is the participants from these organizations. And then VENSEARCH, we bring in the supplier side. So basically what we do is bringing in and being able to based on when Andy gathers the needs, from Rise, they get the needs, we'll go out and we'll match and see what we need to educate on. And then that brings the solutions and suppliers to the table. And then at the retreat, we'll do a case study and an overview, and basically all around no sales, just educating them. But then the beautiful thing that we've seen the success in is that we take it all the way through the remaining of the process and work with those organizations on other solutions that they need. And we do it at no cost, which is a huge win. And so I've actually had it said to me at some of the retreats, and, we're very blessed to be coming upon our third, that, truly they come, they learn, they get brought information, and then we're able to conciergely connect them to the solutions that they need, and we've taken it off their plate. So the combination of Rise and VENSEARCH is it's a really blessed tool for the organizations to be able to use. And the goal is, what are we doing? We're building relationships, right? We're building relationships with each other. We're building relationships with their peers, with suppliers, with solutions, and we're helping. And that's the end result.
Right. I like to say it's kind of this tailor-made solution. I mean, I can't tell you how many times I've had conversations in the past with leaders that say, I don't even go on an exhibit hall floor at a trade show anymore because I feel, the analogy that was given to me that has stuck in my head for years is wounded lamb. And so what we try to do is we just try to make that, right? Where we say, here are the needs that you have, here are the solutions that you, Wade, VENSEARCH has put together that is vetted.
We'll go find it.
Yeah, you've sat in those seats before. These are
Yep.
Vetted sponsors that really pose value to that solution that was requested. And the great part about that is you are agnostic. If they say, okay, great,
Yes.
I like this one, I have the relationship there, but I need to look at a few more, then you have that ability to do that. And I don't think it would make a lot of sense for us to do it any other way,
That's right.
by just making that big grand call of, hey, all sponsors come in here and, we're going to wish you the best of luck. We try to put everybody in the best position to help each other. And, again, that starts with that authentic conversation. And you can't have an authentic conversation if you don't have some sort of a common ground to start from. Right?
Exactly.
So that's where we try to come in. And with your support, VENSEARCH's support that comes in and helps by making those connections on the sponsor side, I think it just adds to the value all the more.
Absolutely. And the collaborative effort of educating on those solutions and then taking that next step of, we literally will work with that organization to go out and get the proposals or engineer and put together the needs or whatever. We become that technology advocate, which is what we are. And then obviously that brings the success of all.
Yeah, absolutely.
So good stuff. Well, I know we enjoy helping, and so VENSEARCH, Rise, VENSEARCH. We're a great team to be able to help these organizations, and it's been a blessing thus far, no doubt.
Yeah, absolutely. I'll say we've made some fun connections, fun memories with a lot of folks, and we've been able to help a number of different
Yes, we
facilities.
have.
With, we sit down, you and I could probably go through a list of all these that say, man, look at the hopeful difference that we made. We wanted to make a difference, but that's what we're here for. And I think that at least the case has been proven that we have that value to share and those connections to make. And so it's fun to watch.
Absolutely, and more on the horizon, no doubt,
That's
no
right.
doubt. And so,
That's right.
hey, check out Rise Health Group. You can check us out. Check it out on LinkedIn. Same thing with VenSearch. Or Andy, what's your website? And if anybody,
RiseHealthGroup.com.
yep, and check out vensearch.com, and you'll see we're gonna put this information out there, and we're here to help everyone. So that's the goal.
That's right.
All right. Well, Andy, it was great catching up, and we'll do it again soon.
Thanks for having me, bud.
Take care.